Hi, good afternoon. I'm Samir Bhandari. I'm one of the consultants in anesthesia and intensive care from Pinderfields Hospital in Wakefield in the United Kingdom. So I'm very happy to be here in Dubai, and we've been running Ultrasound Guided Regional Anesthesia courses for the past few years, and they have received tremendous and wonderful feedback from all the delegates that have attended. We do have a particular way of teaching which has been very useful for the delegates who have attended, and they have taken that knowledge back and applied it at their place of work. So we do teach, basics of ultrasound. We do teach basic blocks for the upper limb, which includes supraclavicular and interscaling. We also cover axillary brachial plexus block and scanning the nerves, the ulnar, the radial, and the median nerve right up to the wrist. We also cover the lower limb, where we block the femoral nerve. We do the femoral compartment block. We also do lateral femoral cutaneous nerve, the saphenous nerve, the popliteal sciatic nerve, and all the nerves that we need to block for the ankle block. We also do abdominal scanning, so we teach tap blocks, and we also teach ilioinguinal and iliohypogastric and rectus sheath blocks. And we also use ultrasound for scanning for the back, so we do central neuraxial scanning for spinal and epidural. And we do have certain lectures, we do have certain topics, but that is far small. It's not a huge amount of time we spend talking, but it's about current controversies in regional anesthesias and the advantages of using ultrasound in our day-to-day practice. So this is on 2 days actually, and it does cover exhaustively, and there's a lot of time for people to do hands-on. So we do have live models that the people do have hands-on experience in scanning themselves, which gives them a lot more confidence rather than just watching experts scan or listening to lectures. So I do hope that you would be able to join us for our future courses of Ultrasound Guided Regional Anesthesia, which is being organized here in Dubai by the IBC. So I hope to see you soon, and goodbye.